Welcome to Future Talk. Today's topic is artificial intelligence in healthcare. How can AI be used to produce better medical outcomes? My guest is Uli Chettipally, MD, Master of Public Health, emergency room physician, researcher, and innovator whose focus is on delivering AI solutions to physicians. He is co-founder and chief technology officer of the CREST Network, which is a research network at Kaiser Permanente that covers 21 hospitals in Northern California. He designed and implemented a clinical decision support system to provide real-time guidance to physicians and received the Pioneer Award from Kaiser Permanente Innovations. He is president of the Bay Area chapter of the Society of Physician Entrepreneurs and serves on the board of directors of the San Mateo County Medical Association. Uli, I'd like to welcome you to the program tonight.
Thank you very much for having me here, Martin.
So tell me, what are some of the ways in which artificial intelligence can be used in the healthcare field?
Well, if you think about healthcare, it's all about knowledge. And there's a lot of information that goes into making decisions, especially when you're thinking about preventing illness or preventing disease. If you're thinking about diagnosing disease, there's a lot of knowledge and information that goes into it. And also, when you make treatment decisions, then also you need a lot of information. And whenever there is, information and whenever there is knowledge, machines always will be helpful in that situation. And so now AI is going to be very useful.
So could you give some practical examples of some of the ways that AI can be used in medicine?
Sure. A good example is a radiologist looking at some images, right? So we train doctors to look at images and look at abnormalities that are in there, like X-rays or CT scans. And as they see more images, they recognize patterns in those images. What is normal, what is abnormal. And then as they become more experienced, they get better at it. Now imagine if a machine can do that. It can learn from thousands, if not millions of images. It can be much faster, and it can also be more accurate when looking for abnormalities. And that's where the current AI technology and machine learning can be very useful.
Now, how can it be more accurate? Can a machine see better than a human doctor, look at the same picture and see things that the doctor didn't see?
Well, there are two things that happen. Number one, yes, it can see better because they can go down to the pixel level. And number two, also they can recognize patterns because they have a lot more memory than a human brain. So you have a series of computers that are learning while they're being trained on images, many images, and so they can know what the answer is.
So let's say you're looking at an X-ray and there are a bunch of spots and you don't know what they are, but they look benign. So now what does the computer do? Say, well, I saw spots like this in another X-ray that was taken 10 years ago at someplace else in my vast data store, and that turned out to be cancer, so maybe we should look at this also.
Yes, that's exactly how they learn, the machines learn, because you're giving it input and then you're looking at outcomes. So it'll try to analyze, okay, for this input, this is the outcome. And so it'll memorize those pathways. And that's how it becomes smarter.
So is the idea that the X-ray goes straight to the machine and the physician doesn't even need to look at it?
The physician is always needed, mainly because there are certain aspects of technology that the technology cannot do, that a human being or a physician can do. And so for those, you need the physician to actually look at the answers and be able to sign off on it.
Now, we're getting to the point that the machines will keep getting smarter and smarter, so we'll need the physicians less and less.
I think there are only a few areas where machines can be better than human beings. The technology itself is still in its infancy. I think we're just beginning. But there are the areas where machines are better are very circumscribed in the sense that where there's a lot of data available, which is easy to look at patterns, which is easy to predict outcomes, that's where the machines will be much better.
Now, what about prevention? Can smart machines predict your likelihood of catching a certain ailment better than a physician could do?
Yes. So we're looking at certain disease aspects where a diagnosis is hard to make, because when you think about a disease, there is a range of symptoms that start, and it takes time for each of these stages to happen, right? So when you're at an early stage, you may not be able to, a physician may not be able to recognize that this is going to end up here, which is a bad outcome. Whereas machines, if you feed them enough data from the past, so they look at several 100,000 patients and their histories and their data points, you can say that, okay, if a person presents with these symptoms, with this kind of picture, with this kind of history, probably you can calculate the chances of this person having a bad outcome.
So basically dealing in probabilities.
Exactly.
It can examine all the past medical literature and all the cases much more rapidly. And is there some centralized data bank where any computer can tap into it, and it's all the records of like every country going back 50 years?
Well, there's not a data bank like that yet, but each healthcare organization can use their own data to be able to do this. And once you teach the machine on certain things, then it is easy to retrain that machine on a different data set.
Now, could you say that the machine is really smart, or it's just crunching numbers?
I think it's basically crunching numbers, the smartness is how fast can it crunch numbers, and how big a data set can it crunch. That's where the smartness comes from. Whereas human beings, it's hard for them to look at large data sets and come up with a conclusion.
Now, what about treating illnesses? Let's say that your doctor wants to prescribe some medication because this medication usually works on most people. Can the machine say, due to your unique genetic characteristics, this has less of a chance of working on you, let me prescribe this other medication instead?
That's a great example where machine learning and artificial intelligence can be very useful. You can look at the past history of this patient, and it can create a profile of a patient where a certain medicine will work better than the others, because it can go through histories, same concept, where it'll tell which treatment option would be better for this patient to be able to reach the good outcome.
Now, you're involved in something called the CREST Network. What does the CREST Network do? You're Chief Technology Officer and co-founder, by the way.
That's right.
It's a fairly big organization. What do you do there?
About 9 or so years ago, we started this idea that what if we gather researchers and give them a huge amount of data and ask questions? Because at that time, remember, the electronic health records were just being implemented. And around 2005, 2006, where our organization had become paperless, which means that every patient's record was electronic. And so we thought, wow, if somebody can come and study this, that'll be great. We have all this data that is, we can mine it and come up with some nuggets, if we can find some of those nuggets, and we can use that to make the care better. And that's how myself and a couple of other co-founders, we got together and said, okay, let's start this network and see what we can do with this. So CREST Network, that's how it was formed. CREST stands for Clinical Research in Emergency Services and Treatments. So we are all focused on the emergency medicine aspect of it. We are all emergency physicians and researchers, so we actually know the day-to-day problems that emergency physicians face, and what are the challenging areas where a little help with computer data will be useful. in their daily practice. And so my role was I'm the technology lead for the group. So I've designed some systems to be able to do that.
Now, I understand that we have a few images that pertain to your work at the CREST Network. Let's take a look at those. Could we see that first image, please?
Okay. So the way we do research is, first we'll look at what has happened in the past for any particular disease. Let's say heart attacks. How does that happen? What are the risk factors for these patients that show up in the emergency department? What are the symptoms when they actually show up in the emergency departments? And then what are the treatments that were given? And then what are the outcomes that happen after the treatment? And so we studied all this in the past, which is retrospective studies.
Sort of profiling a typical heart attack.
And then we describe the data, okay? There were, 10,000 patients that came in with these symptoms. And 5,000 got this treatment, 3,000 got this, 2,000, and then so we describe the data. And the second piece is where we predict. Okay, so if you have this kind of profile, then this is what is going to happen in the future. Or, in other words, if a person comes in with chest pain, we can tell what are the chances of this person having a heart attack in the next 30 days, in the next 60 days. So based on that, we come to the third phase, which is actually prescribing or recommending a management strategy for that particular patient. So we can say, this person fits this profile. So if you use this treatment, then you have a higher chance of, cure or getting better or better outcomes. And so that's how we recommend those treatments to the physician while they're treating the patient.
Okay, now we have a couple more images. Can we see the next image, please?
So this is how we designed the whole the technology infrastructure. So you have data sources. Number one can be the electronic health record. Number two can be what the physician is seeing when he's examining the patient, or what other historical or physical exam findings, that goes in there. And sometimes we also ask the patients for symptoms or for their preferences, and that goes into the data box. And then we have the engine, where it says Big Dog. That's the engine that actually looks at all these variables and calculates the risk score. And the modules are modules we design for each disease category. So for example, for pulmonary embolism, there is a disease category. For abdominal pain, another one. For chest pain, for head injuries. So we have all these modules that you can access, and then it will ultimately give the recommendations.
And what did that last box say? They took it off, but it said CDSS.
Yeah, that is called the Clinical Decision Support System, where the physician actually sees the answers, where they can actually see the recommendations, what are the risks, and what they should do.
So is the idea that the more data you have, the better outcomes, the more the decisions will be accurate most of the time?
So the more data you have, and you ask the right questions of the data, and you have the right analytic tools, which will give you the right answers, so that the physicians will do the right thing for the patient.
And I think there's one more image. Can we see that last image, please?
Oh, this is the award we received for our work at Kaiser from the innovations, Kaiser Permanente Innovations. They gave us this Pioneer Award for this work.
So what we're talking about, this is a real product that's in use now?
That is in use in 21 emergency departments. Physicians have access to this. All they have to do is click a button while they are in the patient's medical record, and it will pull the data from the electronic health record, from the physician's notes. When they enter, they enter the data that is needed for this risk stratification tool.
So is all the data at Kaiser Permanente, or is the network larger than that?
So when we study Kaiser Permanente, because that's the one that we have access to. When you think about data, you could bring data from outside, But the problem is that we are designing the system for this particular population in Northern California. So, and the population that is within Kaiser. As you may know, that each population has different risks. For example, you cannot bring data from the south and put it here because the risks are different and sometimes higher. And we know that the population in Kaiser is different. It's much lower risk. And so we have to calibrate our tools to our population.
Now are similar products being developed elsewhere with different populations? I mean, the basic concept seems fairly simple. It seems like you're just limited by the computer power.
It's very simple. It's actually very simple. I mean, there are a lot of tools that are being developed in the research areas, but we are in a way ahead of the curve because we are actually using it, in real-time research while the physician is seeing the patient.
Now,
in such a large scale.
Can AI be used in things like surgery? Can machines help you do smarter surgery? I know that there's some surgical robots, but I think they're basically puppets. They don't decide where to cut on their own.
Yeah, so most of the robots we see is actually, they are like puppets where another physician is controlling. Where AI can be helpful is in the diagnosis of conditions and where exactly the surgeon has to go to locate the tumor or locate the problem, or where which procedure will be more beneficial for the patient. So those are the things where AI can be very helpful.
What if a new disease comes along? That must happen once in a while. Suddenly you see symptoms you never saw before. Does this fit right in with this? Does it take time to develop the data to be useful?
Yeah, so as long as you have data and as long as you have exposures and outcomes, we can always come up with the answer, or at least that'll bring you closer to the answer on why it is happening.
Now, how does this tie in with other medical fields, for example, genetics? I know there's a lot of stuff going on in genome research. So when new discoveries are made, does that give you more data to work on? Now I know the genetic blueprint of someone. That gives me, when this gene is present, that usually indicates something.
That's a huge area of research and potential for some great discoveries. Right now, yes, we are collecting genome data on patients, but that'll be the future. Yes, of course. We expect that's going to bring a lot of good results. But right now we have so much data already, which is a very like a low-hanging fruit. We can do a lot with it right now.
Are there any limiting factors on the use of AI? Are there any bottlenecks that you have to overcome, or is it just a clear sailing, a clear path of development?
So I split it into 3 areas. So the first area is where people's understanding, especially the leadership and the doctors, they understanding the utility of these tools. So that is a big task because you have to overcome that hurdle, education and actually showing use cases and proving that it works. That's number 1. So that's a huge hurdle. The second part is actually the technology and designing the tools. I think that's a little bit easier step to do because the technology is already there. We have experts that are working on this in other fields, other industries, so it's easier. Although we need to train our researchers to be able to do this kind of work. And the third part is when it actually comes to implementation, and that's a hurdle because you have to have these systems built to be able to use these tools in real time, in real practice settings, while the physician is seeing the patient.
Now there's something in AI called neural networks where you have these feedback loops where the machine constantly gathers new information, decides what information is most relevant, uses that to build kind of a big picture. do neural networks play a big part in the kind of AI that you're working with?
We are working with most basic type of AI and machine learning, but yes, when we start improving these systems, when we get better and better, neural networks will be very useful. There is some research out there that shows that it's very good at predicting outcomes.
So with all this technology, are we getting well, or are we still just as sick as we ever were?
Well, the healthcare system and your doctor is only part of one half of the equation. The other half is you. How do you take care of yourself? How do you take care of all the negative things that are affecting your health? Hopefully, these AI systems will be able to tell the patient also, what they need to do.
So if the machine said to you, you would do well to turn off the TV and go for a walk.
Yes.
You say, well, the machine told me, so it must know what it's talking about.
Exactly.
If my doctor told me, I would ignore it.
Exactly. And then it'll prod you, or it'll keep buzzing in your pocket to encourage you to do it.
So I guess some aspects of health are sort of obvious, but with all this data, can we identify sources of ill health in our society? Can we look at large-scale social trends and say, certain influences are having a depressing effect on health in general, like too much TV programming is making people depressed or lowering their immunity?
Well, there is a concept called social determinants of health. So what we have seen is that what happens in the doctor's office or in the hospital is only a small part of keeping people healthy. Their social environment, which is, whether you have friends, whether you walk outside, whether you can rely on people to help you at home, whether you have psychological problems, whether you have depression, those things have a much bigger effect on health. And then also, the environment, the pollution, all those things, they add up. And so what we have seen is that what we can tackle is only in the hospital or in the clinic is only very small. But all these other things become a much bigger part. How is your family? Do you have a good support system to keep you mentally healthy and socially healthy? Those things have a major impact on health.
Now, mental health is a very big issue. Some people are hospitalized for mental health issues. So does the type of AI you're working on help with mental health issues, like people who display certain behavioral patterns are more likely to become serial killers? And can we tag people and say, you're likely to be extremely antisocial, so we better put you away before you do anything?
No, but definitely depression is a big area, and people, who abuse drugs or who tend to commit suicide, and those are very big areas for study. And I'm sure our artificial intelligence will be very useful for those cases.
In developing AI, does that give us any insight into how our own minds work? Because you're trying to replicate a mind. So is that helpful in understanding ourselves by trying to create thinking machines?
Yeah, I think we're just scratching the surface right now. I think, obviously brain is the most complex machine. I don't think we have learned even 1% of how the brain works. So there's a lot of potential to understand how it works and how we can replicate that.
I understand you're writing a book. What's your book going to be about?
Of course, it is about artificial intelligence. It's called Punish the Machine. In other words, punish the machine, spare the doctors, save the patients.
Punish the machine, meaning make the machine do all the work?
Do most of the work. Because what's happening is that there's a big problem with burnout for physicians right now. And one of the things is that, the technology that we have is not that great. And so it makes the doctors work more entering data, using the electronic health record. And so one of the big reasons for burnout is this extra work that is added onto a physician's daily routine. And
has that gotten worse in recent years?
Yeah, because there's more things to document, there's more things to track.
I know there's more paperwork with the government and Medicare and insurance and stuff like that.
Exactly, the regulatory agencies for the reimbursement, to protect yourself from medical legal risk. So all those things add up because they keep adding to the doctor's workload. So where I am seeing is that where AI becomes, it's in the background so that the doctor doesn't have to physically do things, whereas the machines will be doing most of the work, and the doctor will be doing what doctors do best, which is communicating with the patient, showing empathy to the patient, figuring out things that machines can't figure out. So that's where I see this technology will actually help doctors get over this extra workload that is happening right now.
And doctors have to show empathy. Isn't empathy itself part of the healing process? Like people might get stronger if they feel that somebody empathizes with them?
That's a huge part. I see patients all the time. They come in anxious and they have all these symptoms, and then when they come in to see us or see me and they're laying in their bed, I ask them, how are you feeling? I say, oh yeah, I feel much better. I haven't even talked with the patient, but I just met them. And just for them to be in a situation where they know that they're being taken care of calms them down. A lot of their symptoms get better. So a lot of disease, what we see is a lot of it is psychological too.
We just have about a minute left. Where do you think this is going? Like, where will we be in like 5 years or 10 years from now? Will it just be automatic? You go to the doctor, looks at your symptoms, types a few buttons, and say, oh, you've got 75% certainty you have a certain ailment.
So, through my work, from the physician entrepreneur group that I run, I come across all these new companies that are developing these technologies, and I advise them. One of them is Featherlink and those kinds of companies.
I'm afraid I'm going to have to cut you off because I just got the signal. We're going to have to wrap. Sorry about that. But it's
No
been
problem.
a great interview. Thank you for coming. Thank you for watching. Visit our website, www.futuretalk.net. For Future Talk, I'm Marty Wasserman, and we'll see you next time.